Hello, I am Dr. Mary Rockwood Lane, and I am very honored to do a presentation for you called Healing with the Arts. I want to say thank you for including me in this incredible conference for art therapists. I want to thank Katra Regina, for inviting me. And I want to say thank you for reaching out to me and reaching out and inviting me to do this. And I also want to thank you for taking my course on Coursera, and I will tell the group more about that. I also want to tell you how honored I am to be speaking from Gainesville, Florida, all the way to Poland, because I have been so inspired by the Black Madonna of Czestochowa. I don't know if I'm saying that right, but that Black Madonna as a piece of art has been so precious and so important to me in my life. I hope someday to take a pilgrimage there to Poland to see this beautiful piece of art. And I want to share how powerful an image such as that is to us and to your community and to me and people all over the world. It's a perfect example of how art heals us at the deepest level of our being, and how a piece of art can call us to journey all the way across the world to be in its presence. And the healing power of our faith and the spirit and the beauty of that piece of art. That's how art is in our lives. That's, of course, a beautiful sacred piece of art, but it also tells us how important art is and how it can inspire us at the level of our soul. So I want to thank you very much for inviting me. I'm so honored to be here. I want to start. I love starting my presentations with a guided meditation that allows us to drop into our bodies so we can enjoy this time that we're going to share together. I want to invite you to put everything that you've had to do aside and allow yourself to be fully present in this moment, connecting with the power of your presence, moving from ordinary awareness to extraordinary awareness. Take a deep breath, breathing all the way down into your belly, feeling your connection to the earth and feeling your body. Take another deep breath, moving into an extraordinary space where you're connected to your heart, you're connected to your presence. And as you move into this consciousness of your presence, turn towards yourself and breathe into that spaciousness within yourself. Now feel your presence extending to the edges of the room that you're in, feeling your consciousness expanding, allowing yourself to be in your body, breathing deeply. Now go back to your presence inside yourself, connecting to the power of this moment of dwelling within. Now I invite you to expand your energy to all the people that are here and gathered in this space, in this moment that's happening now, or in any moment where people are listening to this presentation. Breathing deep, feeling your body, opening up your mind, opening up your heart, feeling yourself, giving yourself the luxury of just being here right now. knowing there's nowhere else you have to be and nothing else you need to do, but open up and be here. So it is. I share with you this beautiful singing bowl that was made in Kathmandu, Nepal. And I share with you the power of healing sound. And this is a way I love to bring centering to the beginning of all my presentations, allowing us to sink down into our bodies and give ourselves the luxury of being here in this moment with nothing else but being connected to your heart. Thank you very much. Okay. Before we get started, one of the things I want to share with you is something called the Artist's Creed. This was written by Jan Phillips. And she reminds us how precious it is to make art. So I want to start with that as we remind ourselves that art is so precious in our lives. The Artist's Creed. I believe I am worth the time it takes to create whatever I feel called to create. I believe my work is worthy of its own space, which is worthy of the name sacred. I believe that when I enter this space, I have the right to work in silence, uninterrupted, as long as I choose. I believe that the moment I open myself up to the gifts of the muse, I open myself up to the source of creation, and I become one with the mother of life itself. I believe that my work is joyful, useful, and constantly changing, flowing through me like a river with no beginning and no end. I believe that what it is I am called to do will make itself known when I have made myself ready. I believe that the time I spend creating my art is as precious as the time I spend giving to others. I believe what truly matters in the making of art is not what the final piece looks like or sounds like, not what it's worth or not worth, but what newness gets added to the universe in the process of the piece becoming itself. I believe that I am not alone in my attempts to create, and that once I begin the work and settle into the strangeness, the words will take shape, form find life, and spirit take flight. I believe that the muse gives to me, so does she deserve from me. Faith, mindfulness, and enduring commitment. So I invite you to recommit to you making art in your own personal life. And that is nothing to take for granted. It is actually precious time that we commit to ourselves in the journey of our life. One of the basic assumptions that I have is that everyone is an artist. Everyone is a healer, and the artist and healer are one. I discovered this in my own journey, and in the work of being a researcher, the work of teaching students all over the world. I really truly believe that the art is this part of ourselves that we have deep within us, the resources that we need, that may be unknown to us, We may not have any idea that there's a poem that wants to be written, or our voice wants to sing once again and bring the sound of our voice to the world with joy, or that our body wants to dance again. We want to move and we want to dance and be free in our expression. So art is something that is innate in all of us. And as we return to our creative lives, as we honor our creative selves, we are honoring the truth of who we truly are. We are tapping into our essence. And the other thing that's happening when we tap into our creativity is that we are opening the door to what may not be known to us, that's deep inside of us, that we have no idea is there waiting to take flight. Something inside of us is waiting for us to express itself and free itself and heal us. So I am so honored to be able to share my life story with you and my journey of healing with the arts and my work of integrating the arts into healthcare. And I invite you to celebrate the artist within you and honor your work in the world. It's really important that I can't stress enough the power of embracing the artist within ourselves. I discovered in my own life how powerful this artist was. I also discovered by being a nurse and being in clinical practice how powerful the healing force was within every human being. And really bringing these two aspects of our humanness together just takes us on a very, very transformative journey. I believe everyone is an artist. I believe everyone is a healer. I believe the artist and healer come together as one. And when we engage in this journey with intention and with consciousness, we can invite ourselves and the people we're working with to go deeper within themselves than they may be even conscious or aware of by just connecting with them on talking. Art can take us deeper. Art goes through the layers of what is possible and what is emerging. Our intuition begins to play a part in the unraveling of who we truly are. And we're able to express the truth of our authenticity. One of the things I realized in making art when I started my journey, I started with the pain and the suffering that I was experiencing at that time in my life. And through the painting process, I was able to go to a totally new space. So one of the things that my work is based on is the artist as healer. The artist as healer is also an ancient way of being. In ancient times, the artist and healer were one as the shaman or the medicine person, where when they didn't have what we have today in the modern world of medicine and healthcare, we really were able to work with each other and help each other tap into the inner resources within ourselves. And we were inspiring and harnessing our own inner resources to be able to deal with our lives and deal with the suffering and deal with the pain. So the ancient healer always knew to embrace drumming and dancing and community and singing and really tapping into our imagination and how we could open ourselves up inside ourselves to the realms of healing ourselves, supported by each other. One of the things I want to talk about is the field of art and healing is now really become mainstream. And when I started the program in 1990, it was just a beginning. At that time in America, in the United States, we formed the Society for Arts and Healthcare. And this was a program, and when it initially started, we brought art into the hospital. Simple things that, like Duke University and the University of Minnesota, created galleries in the hospital environment, which was very important. In the early 1900s, when I began the Arts and Medicine program, it was the first program that brought artists and residents to work at the bedside. And over time, it has teamed up with art therapists, music therapists, all kinds of people who are integrating the arts as part of the healthcare system. Now, today, at this time, artists are working at the bedside, artists are singing, artists are putting on concerts, artists are integrating into many different units. At that time, I started in the bone marrow transplant unit, and it has evolved into many ways. In Houston, Texas, for example, which is at the Anderson Center in Houston, it is incredible. The art in the hallways, the art in the lobby, the music that's happening, patients working in the dialysis units, people working bringing music to the bedside. It's amazing what's happening. And now the upleveling of art becoming part of every aspect of our lives is so important. So I want to share with you my story. And I started it as art as was a personal journey where I was going through my own personal crisis. And I discovered my own way, my own journey of healing with the arts. At the time, I'm trained as a nurse, and I worked as a nurse at the Beth Israel Hospital in Boston. I also worked as a clinical nurse specialist, and I was very interested in patients' ability to heal themselves through their own imagery. That's kind of what I became interested in the beginning. I had heard of Bernie Siegel at the time, where it was talking about art and the imagery of art and how it told patients told a story by using their art as a way to relate to their cancer diagnosis. I also worked with Herb Benson at the time and Joan Borsanko when they talk about mindfulness and relaxation techniques, where people go deep in themselves to get to their center and use mindfulness. So when I was teaching at the University of Florida, I was sort of not really, hadn't brought all this together. It wasn't until I had my own personal crisis that I brought this work together in my own life. I was a young mother of two small children. I had been in nursing, but I was at that time at home taking care of my two children. And my husband left me at that time, and I became very, very ill. I became filled with despair, and I would go to traditional therapy, and I wasn't able to burst out of this severe depression that I was in. It wasn't until a friend of mine, who was an artist, invited me to her studio and said, "Mary, come to my house and I will set you up in my studio and I will give you art materials and you can just start making art." Well, back then, I said, "I'm not an artist. I can't make art. I'm no good at that." But something in my life, I was so devastated by what had happened to me that at that time I realized I didn't care if I was an artist or not. My life was already falling apart. So I released that inner critic that told me I wasn't good enough and that I couldn't make art. And we set up a studio downtown and I started making art with her. And then I began a journey. More than just making art, I began to use art as a way of expressing my pain. And my pain was intense. This first painting was the first painting I painted. It was called Cut Out My Heart because I was feeling such emotional anguish, emotional pain. No matter how much I talked about it, no matter how much I cried, no matter how much I screamed, I still felt like I was in this terrible pain. And I needed to release it in some way other than falling apart. Falling apart. I was actually falling apart. So I took this image and I got a canvas and I decided to paint my pain. I had never really painted before. As you can tell, these are garish colors. The woman is distorted. but the emotional expression of my beingness, of my despair, of my everything. It's cut out my pain. I really expressed my suffering. And I painted this with abandonment. I painted this with music. I painted this in my studio. I just let the painting come out of me in this spontaneous way. And it was so incredible. I couldn't even believe it. And then I decided to paint a series of portraits. This wasn't necessarily a portrait of me when I first painted it, but when I looked at it, I recognized myself. This was how I felt. This was real. This was my truth. And I noticed when I painted it, I didn't scream at anybody. I didn't sob for days. I actually released something that was inside of me that needed to come out. The next painting, I did a series of about 6 paintings, and this is one of them. And this is a painting where I began to explore what it meant to be an artist and paint. I painted the figure, I painted my body, I painted my hair. I began to explore with the paints. I explored the colors. I also looked at this painting, and there was something about it that shocked me, that I had no idea that I could paint. I had no idea that I could actually paint myself wrapping my arm around myself. And I noticed not only did the painting express my pain, but I also noticed I was beginning to learn to paint. And I was shocked. I had never really painted before. And I thought, wow, this actually looks like a figure. This actually looks like her arm is wrapping around her body. This actually, I began to feel, I painted the toes. Suddenly, I started to move out of the story of my crisis and my emotional pain, and I began to be captivated by the painting itself. And the process of painting took me to another place that I didn't even know was possible. Took me to another place where suddenly I realized I might be an artist. I was suddenly excited about something for the first time in my life when I had been so depressed, in so much pain, and had been feeling so much agony. So I started painting these portraits. And what I noticed, every time I painted a portrait and I would leave, I would come back to the studio, and it was like something inside me let go. Something inside me released. And I began to experience myself as a witness of my own story. I began to see the shifts in myself. And I also began to have an insight that this was true. I was hurt. I was in pain. And I began to have insight that, wow, I looked at myself and I said, I need to take care of myself. I suddenly took this agony off my face and put it on a canvas, and I suddenly looked at myself and went, I need to care about myself. I need to have compassion towards myself. It looks like I need something in my life. And then I painted, after a series of paintings, I painted this portrait. When I painted this portrait, and I looked at the first portrait, cut out my heart, I was shocked. I was shocked. I was like, I cannot believe I went from there to here. I looked at this painting of my portrait, and it's an attempt. It was one of my first portraits. And I looked into my eyes and the portrait's eyes, and I saw that I was strong. I saw that I was healed. I saw that I had transformed. I thought, and the other thing I realized, I'm an artist. I'm an artist. I can paint. And I suddenly realized that the artist had painted myself well. And I thought, I'm an artist. I painted myself well. I'm strong. Oh my gosh, this is incredible. I have changed my life. I have recognized something in myself that I never saw before. And it was if the art was actually telling me a story about myself. The art was a reflection of me. I was so excited about this portrait series that since I was a nurse, I thought, oh, wow, this is amazing. I have discovered something. This is me. And I decided that I was going to go to the Shands Healthcare Center, which was part of the University of Florida, and I was going to bring art into a hospital. And I had this idea that I was going to invite patients and families to make art when they were suffering in the depths of their pain and their illness. And when they engaged in their creative process, they would tap into the artist within them, and they would tap into the ability to transform their experience into something powerful. And I thought art was a way of healing. And it was true. That is true. But also what I discovered when I brought art into a bone marrow transplant unit, when I brought art to the hospital and asked the nurses and the doctors and said to them, how can we bring the arts into this environment? They opened the doorways. I worked with this doctor. His name was Dr. John Grempole. He was the medical director of the bone marrow transplant unit. I sat down with him one day before we brought artists into the hospital, and I said, I really believe art is healing. And he turned out he was a poet. He was a clown. He was very creative. He, in his own way, was experiencing his own desperation in dealing with patients who were children. He was a pediatric oncologist. He was dealing with children who were dying and families who were devastated. He realized he too was suffering. So when we brought art into the hospital environment, we teamed up with the nurses, the social workers, the therapists, the doctors, and we decided to explore what were the ways that we could integrate the arts into the bed, at the bedside with patients and their families. And the way I started this, and I think it's really great, is I started with the staff and the caregivers themselves. Because when you bring the arts to them and they're using the arts for their own personal healing, and they experience for themselves firsthand the power of making art and tapping into their own creativity, they were able to feel how it benefited them and how it made them feel more connected to themselves and their work and why they went into the profession that they're in the first place. Also, they realized what would entail in bringing arts to the patients at the bedside unit in a bone marrow transplant unit, for example. So they were able to make the pathways possible to be with family. So then we went from them to start working in workshops with families and really bringing the arts to the family whose children or parents or mothers were going through painful procedures in the hospital. And we were able to bring them together, and by bringing them together, we were able to create community for the families together in the hospital when they made art together. So it was incredible. And then those family members invited the artist to work at the bedside with their child or with their mother or with their son. When they invited us in, that's when we began to make art with patients themselves. And what I discovered that was truly remarkable is that art is healing, but art also creates a phenomenon of caring, of allowing someone to make art as a way of connecting each other to the people around us. When we first started the program, sometimes artists would just sit in a room and do portraits of the patients, or they would dance for the patients, or they would sing to the patients. And this began to change the whole atmosphere, the whole environment transformed into a healing environment where artists and creativity became part of the norm. And we actually thought there was, of course, more art on the walls and there was all these art projects happening. But what we really began to discover is that when we bring the arts into our healthcare systems, it connects us at a different level beyond words. And that was one of the most powerful teachings that I learned, that art is actually creates these caring encounters where people can share the authenticity of who they are with another human being at the level of truth, at the level of being able to us recognize and see the suffering of others in a more powerful way. So as this program evolved, it became something that became integrated throughout the hospital. And what also happened is the value of the creative process became recognized as we be able to bring this. It became like a movement. And at that time, many years ago, people would come in and come to this hospital because it had an arts and medicine program, because when they walked into the hospital, they could hear the piano playing. They walk into different rooms and they see art on the walls that were created by the patients and the staff who were working together. They would have art on the ceilings. They would walk into the atrium and there was 1,600 tiles that were made by patients and families and health caregivers together. And you could see that there was a human experience that every one of us shared through the gift of people sharing their art with others. I think when we share our art with others, we are sharing a piece of ourselves that's not just our own personal experience. It resonates with others who have similar experiences. And this is truly remarkable. I ended up, after beginning the arts and medicine program, my journey was to become a researcher. So I enrolled in the College of Nursing, and I wanted to study art as a way of healing and study the lived experience of people who made art. People who articulated that art was healing. What was that about? What was the lived experience? So as a researcher, I basically began interviewing patients, family members, staff, anyone that could talk to me about the story of what they saw when someone made art. And this was remarkable because it really informed me what was actually happening. And since I was a nurse, I was really interested in what was the lived experience of someone who made art. And I ended up collecting data for many years, and then I used writing as a way of inquiry, and I used a technique. I studied with Max Van Madden, who wrote the book Researching the Lived Experience, and the methodology was a phenomenological hermeneutic methodology of qualitative research, where I interviewed people to tell me what their story was when they made art as a way of healing. It was interesting because the stories had themes that emerged, and the themes were deep. One of the ways I saw and listened to the stories is each person who articulated art as a way of healing basically started with their pain, started with the suffering, started with where they began in the darkness of whatever they were dealing with at the time. And that's where their story began. And that's where the art began, was inside that story. Their life was they had art materials, whether it was music or dancing or visual arts or poetry. Whatever the art expression they had, they started with their own life. That was the canvas and the materials that they worked with, their feelings, their emotions, making of the art. So each person who started this journey was invited to make art by somebody, by either the artist that came into the room, or a nurse that came into the room, or an art therapist that came into the room, where they began this journey and something triggered them to make art. What they articulated when they made art is they all of a sudden stepped into the flow of creativity. That is like stepping into something that's energetically happening in your body, where they used the story, and it happened to me when I made my art. I started with my pain. I expressed my pain. I released my pain. And then I started painting. And then when I started painting, I moved out of that story into a feeling inside myself where I would say I was in the flow. I slipped out of this despair into this creative flow. And when I stepped into this creative flow, I released the inner critic. And by releasing the inner critic, I invited what needed to come out of me just to come out of me. And I had faith and I trusted the process. And it happened quite spontaneously and it happened on its own. So intuitively, I began to paint. The other thing that people talked about, which I thought was really interesting, is there was a sudden moment where they connected to an inner witness. They actually talked about this inner witness, and they had an insight into their own experience. And that was something that was one of the themes that emerged. And then the next thing that happened is they had a feeling of self-compassion, which allowed them to step back and see themselves. The next few steps that were really remarkable to me was when people told a story of their pain, they also connected to something that was deeply spiritual within themselves. And there was a moment of transcendence. I want to share with you a story of a patient who was having a bone marrow transplant. He was very, very sick. He literally was admitted to the emergency room with leukemia, and he was drowning. He was drowning. And he was admitted to the bone marrow transplant unit. He was depressed. He was despair. He thought he was going to die. An artist came in the room and brought him pencils and papers, colors, crayons, art supplies, and he didn't want to touch them. But she left them with him. So what he did before she came back was painted the chair, a stick chair, in the corner of the room. Just a stick chair, very basic. And she really sat down and started coaching him and supporting him and encouraging him to draw. He ended up painting or drawing 72 images every single day. And these images were so powerful. They were of water. They were of lakes. They were of islands. They were like, he was like, there was this ocean that was emerging in his work. This was ocean. And then one of the days he painted an island in the middle of this ocean. And then the next painting, he painted two bodies of water, two land masses. One was the island and one was another land mass. Then in one of his paintings, he built a bridge from one landmass to the other landmass over this ocean. And suddenly had birds in the sky and trees in the imagery. And he began to realize that he was going to make it to the other side. His images were leading him on a journey that he was actually going to make it. He could cross the bridge and he was going to be okay. So his images that he drew gave him that message. And then I said, well, what is it about those messages or what you're experiencing was that you believe art healed you? He said, I was walking through the forest. This is in Gainesville, Florida, where the university is. He had been discharged from the hospital. He said he was walking in the forest, and he said, I started to look around the forest, and I began to realize, since I had been drawing, I began to realize the beauty of the trees and the beauty of the leaves and the way the sun came through the forest. And the forest had smells. And suddenly I was able to see the world through the eyes of an artist. And I suddenly saw the whole world differently. It was alive and it was beautiful. And I felt this oneness. I felt this sense of oneness with everything. And that sense of oneness is what was healing for me. And I listened. And I said, oh, wow. And he says, and now I do sculpture. And, I worked as a car mechanic. And now I'm doing sculptures on my weekends off. And I'm starting to rebuild my life. And I have a creative life now. And then he started telling me the story of his life. But there was a moment where you could see for a moment, there was this moment where he was connected something greater in himself, greater than himself, in the moment of him seeing through the eyes of an artist. And that's what happened to me, and that's what happened in so many of the stories, that art took them to a place where they were able to connect with what they talked about was the essence of who they truly were. And I discovered this again in my life. My grandmother was dying. She had dementia. I was really in tremendous pain. I was doing the arts and medicine program and working with arts in the hospital. And I decided when my grandmother had Alzheimer's disease, I was so, so heartbroken. I couldn't believe I had lost my grandmother. So I would go sit with my grandmother and I would draw images of her. And I will share with you my grandmother's series. And this was a series that I just threw myself into when I was in graduate school. I returned back to my painting. And I went to my grandmother's. She was in a home and her mind was fragmented. And this painting is called Only Childhood Icons Linger, because my grandmother had a few icons in her room. She had the crucifix. Was lost inside her world. I would sit in bed with her and I would ask my grandmother to tell me stories. And they were always fragmented stories of her childhood or fleeting memories that were just, and sometimes she recognized me, sometimes she called me her mother. She was in another world, and I could see inside of her that she was having these images and these stories that were there, and I just was like listening to her and drawing pictures of her and being with her and holding her. And my paintings were soothing me because I was at that time in so much grief. So I did a series of paintings of my grandmother. The next painting you can see is that she's rubbing her eyes. She's sitting in her chair. She has a few icons on her dresser, very few things. But she is there and I'm visiting her and I'm just sitting with her and I'm just being present with her and I'm just trying to hold space with her. In the same way, I was looking at her closely and I realized how much I loved my grandmother and how as a painter, my grandmother was the object. It was like I was painting my beloved. And that was inspiring me to paint. And it was making me happy inside my sadness and my grief. So I did this series, and this is the last one, right as she was passing away. It was like my grandmother was looking up at something, and I had this image of myself in this ethereal way to where she left me, and I had this feeling of just being so sad, so blue, so like helpless at the time. But the painting I created a relationship with my grandmother that I could hang on to for the rest of my life. And I was able to be with her and paint her. And as I realized it slowed down my life to where I could be in the moment with her in a way that I had never really been with her before. I was able to listen to her stories. Grandma, tell me your stories of your childhood. Tell me what it was like to be a child. Because sometimes she would go back and she'd talk to me as her mother. And I'd say, tell me what's going on. So at that time, it's like, it was amazing. I was painting her. I was writing down these stories of her life that I had never heard before. It was like pieces of the puzzle of myself and my own, the way I was raised. I was understanding things about myself as a young person that I never knew, that were secrets that were hidden in my family that she was telling me that I had never heard before. So it was an incredible journey to be with her. and I would play her favorite music, and we would laugh, and we would spend some time, and there were moments of connection. And one of the things I've discovered about re-engaging people, there's a whole body of literature that is on the internet that talks about how music wakes up people who are in their dementia, and they wake up and they suddenly begin to sing again and talk again, and for a moment return to themselves again. That's an extreme example. But art is about us returning to ourselves again. So as we invite people to make art, we are taking them back to themselves. And they are sharing the intimacy of who they truly are. And that is so powerful. I want to share with you how we use art in a way of healing and how you can integrate it and how much, even as you implement, you are doing your work as a caregiver and whatever that work may be, as an art therapist, as a nurse, as a physician, as a social worker. When I invite you to implement the arts into your practice as a way of intervention, but also as a way of creating a healing environment. One of the things I encourage you to do is make art part of your own life. Make it part of your own self-care, of what you need to do to reconnect yourself to what you're most passionate about. How we can use art as a way of caring for ourselves and expressing ourselves. Everyone is an artist. Everyone can sing. Everyone can dance. Everyone can write. They have studies that show there's research all over the place. Like they did research with women with breast cancer. The group that sang did better than the group that didn't sing. There is so much research out there that supports how the creative process is so powerful. And the truth is, I've studied all the research. There's been research forever. But one thing you do know, and I know, I've seen the work, that the difference it's made in people's lives, and we know it intuitively that art is good for us. People love to sing. People love to dance. People love to watch artists. It's our innate capacity that's within every one of us to heal ourselves with our creativity. It's part of being human. And art, one of the most incredible things is when sometimes we see the art of other people, we can experience the depth of their humanity in a way, and sometimes in a deeper way than just having a conversation. There are moments in our creative lives that illuminates the very essence of who we are as human beings. And I have seen this over and over again. When people make art, they illuminate themselves. They are seen, and we see them, and we are connected at a much deeper level than we were before. So I invite you to make art in your life. I invite you to encourage not only your patients to make art, but your friends and your family. And we need to reclaim the arts in our culture. I want to share with you this book I wrote. It's called Healing with the Arts. And this was my first attempt at I was teaching at the University of Florida. I was teaching the course initially, and then I wrote the book, Healing with the Arts. And this you can buy on Amazon. And it's just a way for you to engage in your own personal creativity. But what I've got really exciting news is there is also another option that's on Coursera. Coursera is a university platform where universities from all over the world put courses on Coursera. And you can take courses, you can take my course, Healing with the Arts there. You can take all kinds of courses on Coursera, and it's totally free. So I invite you to use this course as a resource for your own engaging in your own creativity, because the course invites you to explore all these different modalities to sort of get your creative juices going. You know, there's a module on dancing, there's a module on singing, there's a module on writing, there's a module on poetry. There's all these different, so it's like, I believe if we get ourselves into creative modes, all of a sudden we begin to know what resonates with us and what doesn't. So I invite you to use this course in your life and invite other people. You know, you can use it as part of your clinical practice with others. So Coursera is a 6-week online course. It has tremendous resources. And also you can sign up on my website, Healing with the Arts. And I am so committed to this work. I want to bring, I send out quotes once a month. I send out healing art tips. And there's also this incredible community on social media. There's over 10,000 members in a Facebook group on Healing with the Arts, where you can post your art and be connected to people all over the world who's making art. So I just want to thank you for your time and your attention. And I want to end with reminding you that you are an artist. You may not know that, but you are. You may be a gardener. You may love cooking. Whatever you do that brings you more connected to yourself and your creative art, your creativity, something that opens your heart and you're passionate about, you are an artist. And when you invite your artist to step into your life, you are tapping into a wellspring of creativity and the wellspring of your own inner life force. You can partner with the part of you that has that energy, that has that vitality, that we step into our consciousness and we allow ourselves to be the most creative human beings we can be. And when we do that, we not only do it for ourselves, but we bring the gift of ourselves to the world. So thank you, and express yourself. And when you do, share your work with others. That's how we create community, and that's how we build bridges, and that's how we learn not only to heal ourselves, but when we heal ourselves, we also are healing the world. Thank you very much.